Good evening, everyone. I'm AnnMarie Cronin, and welcome to our live weekly medical show on News Talk 760 WJR. We're going to be talking about the prevention of disease and the urgency of taking action before the onset of serious medical problems. Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention, is here with us to tell you what you need to know about how early screening and knowing your profile can lead to the avoidance of heart attack and stroke altogether. Pre screening and simple non invasive tests can actually prevent Alzheimer's and many of the other chronic diseases. If you have a question, we're opening up the lines and taking your calls. So please make a note of this number, 800-859-0957. Again, that's 800-859-0957. We'll be repeating it throughout the show, and this is your chance to talk directly to the doctor. So stay tuned. We'll be right back. You're listening to News Talk 760 WJR.
Or on Facebook. How about that?
We're on Facebook Live. There you go.
Well, welcome listeners and people on Facebook. We're going to have a hopefully a good show today and talk a little bit more about COVID, where we are with Omicron, maybe political COVID talk since the Supreme Court made a ruling on the vaccine mandate. Well, it depends what your side is. So I don't want to say for or against, but we'll talk about that during the show or leave that open if anyone wants to talk about it. Anything you want to talk about today, AnnMarie?
What we can do if you get it. That's the most important thing. Forget about vaccines. Forget about masks. There's all, I put the news on today and I see you can get masks here, fake masks there, good mask, bad mask, K95, 95. Who cares?
Right.
All that anybody should care about is if you get sick, you better have a doctor who's going to take care of you. It's simple, stupid, and to the point, because I'm not interested in dying of COVID.
It is true. And that is the bottom line, because as we've learned, well, we'll talk about it more during the show. We're kind of review last week's 3 new Kolender mandates, right?
Well, yeah, what are the 3 new Kolender mandates?
We talked about them last show. Don't you remember?
Yeah.
You don't want to say them. You
No.
don't want the words coming out of your mouth.
Right.
Okay, fine. So we'll talk about the Kolender mandates. How to handle COVID today. Doesn't mean it won't change tomorrow, because COVID's rapidly changing.
There's another variant out now, isn't there?
Don't ask me live, because I don't know. Yeah, there's always another variant.
Welcome back, all of you listeners, to our live weekly medical show here on News Talk 760 WJR. I'm AnnMarie Cronin, and we are back again tonight to talk to you about prevention and why you have to start looking at healthcare from a different perspective. Dr. Brian Kolender, MD, is joining us from Birmingham, Michigan, to give us some hard talk about dealing with our health and making sure we get the necessary testing. We're inviting you to call in if you have a question at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, always a pleasure to hear the news. What do you have to tell us about where we're at with COVID right now?
Well, we're going to review the Kolender mandates for COVID again when we get going.
We're ready.
But right now, in my practice, the Omicron has really quieted down. So last 2 weeks was madness in terms of vaccines, not vaccines, but people calling sick, treating people. And it's quieted down in the last 24, 48 hours significantly, where I may not have had a real call today.
Really?
So today's probably the first day in weeks that I've not prescribed something for somebody.
Well, I guess the hospitals were blowing up again for a while, and Matthew Sims was on TV every 5 minutes talking about what to do and what not to do. So again, it was the weight that was falling on hospital admissions.
Well, when you can't see your doctor and you can't get any medical advice and you don't feel good and you've been told by the news that you're going to die, well, then you go to the hospital.
Oh, well, that's not improving your condition much.
Right, but that's why the hospitals are full. The hospitals are also full because there's less hospital workers. Probably a third of the hospital workers walked off the job or were fired because they are choosing not to get vaccinated. So all this talk about hospitals being full are really not quite accurate. It's more about hospitals are understaffed. They're
That,
full to the capacity that they're able to take people given the amount of staff that they have. But people have been forced to leave because they have choices, and they chose their health over a political mandate.
That's a problem. I mean, because that's true. There were so many people that were going to be let go from Beaumont and various different hospitals if they didn't get the vaccine.
And that's going to continue. Unfortunately, the Supreme Court did block the mandate for employers to vaccinate, companies that have over 100 employees. But they did continue to approve the mandate for hospital and healthcare workers. And I think this is going to continue. This is going to cause additional strain to the healthcare system because healthcare workers don't want to get vaccinated. And that brings us to mandate 1, Kolender mandate 1. Don't boost. Vaccines are not working anymore. So no need to get vaccinated or boosted with the current lot of vaccines, because in my experience, vaccination status does not predict illness from COVID. You're vaccinated or not vaccinated, you're boosted, you're not, whatever variable you have, you're going to get Omicron if you're exposed.
Yeah.
Can I jump in and ask a question really quick? Not to interrupt, but are any people being exposed to any of the other variants still, or is it completely Omicron?
Right now, it's 100% Omicron. Now, there may be other variants that they've discovered. They haven't really come in yet, but by early December, Omicron quickly became the dominant variant. So we went from all Delta to all Omicron in probably a week. I mean, that's how quickly Omicron spread. And, I can't, well, I should say my streak of no hospitalizations ended today, but
yeah, but it really didn't, because you had someone go to the hospital about something entirely different than COVID.
Whatever.
No, that's true. I mean, let's keep up the batting 100% the way it was before.
That's the thing about medicine, is that it's a humbling job. You can never really, every time you think you're great, nature takes a swipe at your ego. So
yeah, but you're one patient who went in because of blood clots attendant to being exposed to COVID. So he wasn't going in to be treated from COVID.
Well, he's also post-operative. It's a complicated story. It's not all COVID, but
and he's not in a ventilator, and he's still alive.
He's going to do fine.
He's going to do fine.
He's going to be fine. But again, other than this one outlier, my experience with Omicron has been very, I would say, easy to treat. People recover, and we're using all of the frontline medications and supplements without any difficulties at all. And that might bring us to Kolender mandate number 2, which is use a pharmacy that is going to fill your prescriptions whenever you need prescriptions filled. And so my personal experience has been that using the big box pharmacies, CVS, Rite Aid, Walgreens.
Let's just name them.
I did. And because the people need to know. And,
okay. Big box is big box. Yeah. Go ahead.
Well, they're just not reliable. When your life's on the line and you need a drug, and some random pharmacist is going to decide whether or not to fulfill your prescription, they're putting my patient at risk unnecessarily based on some belief that is not based in reality. And so, I'm making an effort to boycott all these pharmacies, and I would encourage all the listeners to do the same.
The pharmaceutical companies, not the pharmacists. But anyway, right now we're going to have to take a short break. Again, you're listening to our weekly live medical radio show, where we keep you up to date on all medical solutions, from dealing with COVID to avoiding catastrophic disease. We're here with Dr. Brian Kolender, MD, talking about prevention. If you have a specific question and you'd like to talk to the doctor directly about what you need to do to prevent or reverse disease, please call us at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
Well, we're still on
Okay, so we should
Facebook.
be on Facebook Live.
Right.
Yep.
Yeah, Mark, we've got to lower Siobhan and
Yeah,
our
Siobhan is
ears.
blasting our ears off.
Okay.
Siobhan, we were worried. Wait, hold on. She's at another.
It's possibly on my end. Is that any better?
Yes, it is. Thank you.
Okay.
Yeah,
all
much
good.
better.
Good.
Good. Yeah, so we've got to hit the third calendar mandate, which I'm blanking on. We can say it
That's
on
good.
Facebook, but not.
Siobhan,
but not
you got to turn it
live.
down more, Mark says.
Turn it down more. Okay, hold on.
Olivia, what was it? No boosters, no CVS, and what was the other one? I can't remember.
How is this sounding now? Is this better? Still too loud?
No,
You're
it's
still
much
loud.
better.
Much better? She says
Yeah, it's
still
good.
loud? What's the consensus?
It's manageable now.
What does Mark say?
Okay, well here, let me turn it down even more. How's that?
That's good.
That's good?
What happened to you? Did you get stuck in traffic?
No, our flight was it wasn't really delayed. They didn't tell us it was delayed until they just left late.
That's why you have to
by the
always
time we got
alwa-
in, yeah, it was just
you have to always fly Delta. What did you learn?
yeah.
You have a little echo.
I
We
do. I have an echo.
Sorry, Mark. It's a rough day. We have echoes now.
Echo from where? Me? I have an echo.
I hear an echo. There, it's going away.
How about me? Am I any better?
Yeah, you're
Yeah.
good.
This all good? Okay.
Yeah.
So what's
we're
the
at
third?
19.
Or the third?
I'm
Where
so
the
blank.
third mandate for you? When
Well,
it's not the pharmacist. I found out it's the pharmacy.
no. The pharmacy is giving the pharmacist the leeway.
Really?
Yeah.
You're
So
sure
it's-
about that?
Yes.
How'd you find that out?
Well, 'cause I asked.
Who?
Well, it's the same pharmacy, and random shifts, they will or will not fill a
Oh
prescription.
my gosh.
So they're giving it up to the pharmacist to make a medical decision based on their idea of how to manage COVID.
That's
Don't
really
ask me
bad.
the third because I can't think of it yet.
That's really bad. A random, you can go at one shift and get filled, and another shift you can't. Well, we should be back right now, like in 10 minutes, 10 seconds. What are you coming back with? COVID
We can
mandate
talk.
number
We
3.
can talk about. Sure. Oh, I forgot what it was. I think it's early treatment. It's early treatment. Continue early treatment. Thank you.
Yeah, making sure you get the right doctor to help you
Right.
out, which is what I said on Facebook Live.
No one's really watching this Facebook show anyway, so it's okay.
How do you know?
Because we'd be canceled if they
depends.
were.
So
6
you've always
viewers.
seen?
Yeah. Yes, 6.
Some people watch it after the fact though, so you have
You're
to look at
right.
the views that happen later too.
If you're just now joining us, I'd like to let you know that we're welcoming you to our special weekly medical radio show on News Talk 760 WJR. We are back again with Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention in Birmingham, Michigan. After 20 years in practice and watching patients die prematurely and unnecessarily, he's here tonight to give us some hard advice on what we need to do to avoid heart attack and stroke altogether. We're inviting listeners to call in with your questions at 800-859-0957. Again, that's 800-859-0957. Dr. Kolender, obviously, we're always still on the topic of COVID and pharmacists willy-nilly prescribing or
refusing to
refusing
prescribe.
to
fill prescription.
refusing to fill prescriptions, which is unbelievable. What's the average patient to do? He gets a prescription from his doctor, he goes to fill it, and then what? Where does he go?
Well, the key is finding a doctor who's going to write you a script for COVID in the first place. That's the hard part.
For the medication.
Yeah, is it shouldn't be that hard. I mean, knowing what pharmacy is going to fill your script doesn't really matter if no one's going to write you the script. So you got to have a script to worry about getting it filled first. So the key, you've said, AnnMarie, many times, is you got to have someone who's willing to treat you and not just say, sit at home and wait till you think you're going to die before you go to the hospital and get on a ventilator.
Can we talk about some of, not to interrupt you, but can we talk about some of the early treatments you're prescribing specifically for Omicron compared to some of the prior variants?
Yeah, no, so I'm still recommending supplements. I'm still making sure everybody's on a lot of vitamin D3. I'm still making sure people are on zinc, vitamin C, quercetin, which is a natural anti-inflammatory. I like ginger. You can boil ginger root and drink it as a tea. But when somebody is sick, then I'm treating them. So that brings us to Kolender mandate number 3, which is don't bother with testing because the testing isn't working. I've had patients who are sick have negative rapid testing and negative PCRs, I'm sorry to say. So I'm treating people based on symptoms. If they are sick with a viral syndrome, I'm putting them on, either vitamin I, which I'm not going to say these words anymore. And if they're really sick, then I'll combine a bunch of pharmaceuticals that we've talked about before.
Siobhan, we have one caller.
Yeah, we do. We have Mark on the line in Windsor. Mark, what's your question?
Hi. I just wanted to confirm. This is the first time I've heard a doctor say that there's no clinical reason to get the vaccine. Did I hear that right? Or
well, in Canada, you sure aren't hearing it anywhere else. That's for sure.
We have our foot on our necks here.
Yeah, you're in jail.
There's so much pressure. Factory workers are losing their jobs if they didn't get the vaccine. Hospital workers, truckers. It's all happening now. Well, Omicron is going wild through the province. We have more, something like 85% of our population is fully vaccinated, but we have more COVID in the province now than before the vaccines were available.
Well, cases don't matter. How many people get COVID doesn't matter. What matters is the vaccine actually helping? And maybe it definitely did in the beginning. And then with Delta, it was maybe 50%. And with Omicron, it's 0%. So I'm just finding that it's a milder disease and there's no reason to get a drug or a treatment for something that doesn't work. And the thought of, well, it doesn't hurt. I'll get a vaccine or a booster because it doesn't hurt. That's bad thought. That's a bad thinking, because why would you take a drug that has no benefit? All you're dealing with then is side effects. There is no free lunch. Every treatment has a side effect and complication. And if it has no benefit, you should not take it. And there's
3,200 people in the hospital in Ontario and 500 in ICU. That's more than we've had. And the provincial government's been good about keeping track of the percent that were fully vaccinated. And I mean, they were until Christmas, but the last time they published, as far as new cases, the last time they published that was 80% of the new cases were fully vaccinated.
Right.
And then, no, I mean,
at least they're
about.
Well, I'm going to interrupt you here, but how does the government and the news media promote vaccination when you get a statistic like that, where 80% of the people in the hospital are vaccinated? And I don't know that hospitalizations are a data point that matters either, when there's no attempt to keep anybody out of the hospital.
Right.
There's no attempt to provide early treatment, no attempt to manage people on day 1, day 2, or day 3. The only treatment is stay home and wait till you think you're so sick you have to go to the hospital. And there's no,
that
at least,
describes,
and in the U.S., there's no.
Ontario.
Well, the same as the U.S.
Ontario, 100%. They say don't. For 2 years now, clinics are closed. Doctors' offices don't want to talk to you. They basically said take 2 Tylenol and call an ambulance when you can't breathe anymore.
Well, it's scary when a national health service, like in Canada and in the UK, stops taking care of the people that they're, they've been mandated to take care of. And here in the United States, at least I understand, because the government's been bought and sold by pharmaceutical companies, at least you understand someone's making money on this at our expense and at our health. But it doesn't. I don't understand why this is happening in Canada or in the UK or other countries with national health care. Well, thanks for your call.
That stood up.
Yeah.
Oh, sorry. Anybody that stood up and any doctors that stood up, they were thrown out of the medical establishment.
Well, don't
It's been
jinx
brutal.
me.
Yeah.
Well,
No,
no, but
I love how you're doing.
the good point is that anybody that's living in Canada that can cross over the bridge and come to see you if they
Not
need treatment.
really. I
Yeah,
mean,
they can. Why
well,
not?
they can. It's the border crossing is difficult. You can't go back. It's you've got to be positive. You got to be tested and tested. It's the borders crossing is. I think it's challenging to go to Canada.
Mhm.
So it's anyway. You need to find somebody out there, people, that's willing to treat you. And it's not easy to do when the whole system is based on what the FDA is telling you, what the president's telling you, what the president's medical advisor is telling you, when all of the evidence points to that the vaccines are no longer helping anybody. And I just don't believe the line that, well, it's making you less sick anymore.
Yeah, but look at Beaumont, for example. Matthew Sims is on all the time talking about the fact that like 80% of the people that are in the hospital that are sick, that are on ventilators, were not vaccinated. That's a fact.
Well, this gentleman just stated a fact that said 80% of the people in the Canadian hospitals are vaccinated.
Right.
And I think that we watched a thing on the news where they had a graph from a Beaumont doctor saying this is months ago, 40% of the people in the hospital were vaccinated. If they're willing to admit 40%, you know that's more than 40%. And that was a delta. Now with Omicron, when it really there's no immunity benefit. No one has natural immunity against Omicron, whether it's been acquired or natural from prior exposure. So everyone's exposed. And again, I have great respect for Dr. Sims, but if you make no effort to keep somebody out of the hospital and all that they know is to go to the hospital, well, then they're going to go. And that's all there is to it. So there's all this talk about hospital numbers. I don't say who cares, but there's no alternative.
Yeah, because
but to go to the hospital.
You can't get in to see your primary care physician much anymore. Let's come back and talk about this on the other side of the break. Again, you are listening to a special live medical broadcast on prevention and the medical management of disease. If you have a specific question and would like to talk to the doctor directly about what you need to do to avoid heart attack and stroke, or have a question on any of the subjects we're discussing tonight, please give us a call at 800-859-0957. Again, that's 800-859-0957. You're listening to News Talk 760 WJR.
Well,
back on Facebook.
Yeah, back on Facebook Live.
So that was an interesting caller, I thought.
Mm-hmm.
Mainly because the call never ended.
Well, that was okay.
Yeah, it was okay for you.
Well, I mean, no, it's good to hear. I mean, what the perspective is from another country or what's going on in another.
Right. It was okay for a little bit.
Mm-hmm.
Anyway, we love all our callers. Keep calling. So maybe we should get into the pig heart thing a little bit.
Yeah, we got to
get. Worth talking to about.
That's the news, Shivani. You aware of that? The pig heart transplant?
Yeah, just a little bit, and then get back
Who
into
do
our
you
wheelhouse.
know?
Well, she's busy working.
No, I'm not aware of the. No, I'm not aware of the news. Yeah, it's interesting. I'm excited to hear about it.
Yeah, heart failure. We talked about heart failure on the recorded show that we're doing on Sunday. And all the causes of heart failure. And this particular guy, 57 years old, was just given a pig heart. And
wow.
they genetically modified pig heart. So Dr. Kolender was on
Interesting.
Paul W. Smith on Tuesday. Was it Tuesday morning? Yeah.
No, Wednesday.
We did have another caller
yesterday.
coming, by the way.
All
We're
right,
back
good.
on the air.
Okay, good.
So what do you want to do? Go to the caller? Or
yeah, always. Callers are good.
I say we ride. Yeah.
2 callers.
Take the callers
You're right.
while we can. Yep. Okay. Yeah.
Oh, we have got a long.
And someone from Flint.
Yeah, we got a long.
Wait, you
break.
have 2?
Yeah.
Mm-hmm.
Who's calling from Holly?
Chris. No last name.
Are you expecting somebody?
No, in Flint. I just want to write down who's calling.
Chris from Holly and Randy in Flint.
Okay.
I just like to make sure because there's some guy that keeps calling all the time.
Well, Dan or Ken.
Yeah, right. You even know who he is.
Well,
Okay.
he changes his name periodically, but he's
The voice is the same.
he's got
A
good
very
questions.
distinctive, yeah.
Yeah.
I wonder what's happening to all of our Korean listeners if they're still following us on Facebook.
I'm taking a look.
Oh,
we have
really?
3 callers now.
All right,
have
there
three.
goes anything
Yeah,
I
it's a
want to say.
hot topic.
Right. Well, when you lay down the calendar mandate, damn it, that's all there is to it. What were they again?
This is segment 4.
Yeah.
You're not going to be
Apparently
talking.
3 was don't test. Was that what it came down to?
Right. Don't test.
Forget testing.
Don't boost.
Don't test.
And don't go to any pharmacies.
My God. Leave the country.
Yeah. Apparently not. Because our
Right.
Canadian
Oh,
friend told us it
Canada
wasn't much
went
better.
nuts. Okay. Well, Canada went nuts. I mean, there's only 25 million of them, and they're all locked up. I mean, in jail.
Mm-hmm.
They can't do anything. And it's been like 2 years. I don't know how that place is working at all.
How many of them are dying compared to here?
I don't know. They can't afford to lose too many.
Yeah, well, somebody must be.
Well,
treating
they're all
them.
vaccinated. That's for damn sure.
You got to stop being so anti-vax.
Today we are. I wasn't always,
Yeah, I know, but
but it's different
going
now.
against-
No, but I understand. You're saying why take a treatment that's only producing side effects
Right.
if it's not actually effective against what you're
Look,
trying to treat?
COVID's
Welcome back to our special live medical broadcast on News Talk 760 WJR. We're fortunate to have Dr. Brian Kolender, MD, internal medicine physician and specialist in prevention. He's here tonight to give us some straight talk about 2 important topics, prevention and being proactive. Please tune into our weekly shows Sunday afternoon at 3 p.m. and live Thursday at 7. We're inviting you to call in with your questions and talk to the doctor directly at 800-859-0957. Again, that's 800-859-0957. And Siobhan, my co-host, welcome back. You've got some more callers for us.
We do. Let's start with Chris and Holly on the line. Chris, what's your question?
Hi. My question is for some of the healthcare workers who because of the Supreme Court ruling today, might lose their jobs. My wife being one of them. I do believe that they're going to honor exemptions for this.
I don't know. I think it's I've been asked today actually to write an exemption, and to be honest with you, I can't imagine. I just don't know what medical reason there would be to give an exemption that a third party that wants you to be vaccinated would approve.
That's
I don't
interesting.
have an
You
answer.
got asked today. You got asked by someone
by
to
a relative.
Okay.
And it's I
Dodgy.
just don't. It's not that it's dodgy. I can't. I always think of myself as if I got a letter. How would I read it?
Mhm.
I'm happy to do anything for my patients, but it's like, how would I read this letter? And if I'm thinking this is BS while I'm reading it, and it's my own words, I'm not going to send it. And
Mhm.
the fact that I don't believe you should get vaccinated or boosted has nothing to do with an exemption. It's across the board. It's if you're really sick, then you probably would consider being vaccinated or boosted. And if you're healthy, then absolutely not. So what exemption is there going to be that someone who thinks you should be vaccinated or boosted is going to read and go, oh my God, this is a good reason?
Well, we have a couple of other calls waiting. Thanks for
Yeah,
calling,
tricky
Chris. Go
situation.
ahead.
Yeah, thank you. Up next, we have Randy in Flint. Randy, what's your question?
Yeah, I just got a question for the doctor real quick, the guest doctor. I love your show. Real quick, what type of damage does Omicron do to the lungs? And I guess my question is 2 parts. What type of damage does it do to the lungs, and is the damage sustainable?
Well, thanks for calling, and thanks for the support. You know, all of these viruses are new. And so, I mean, Omicron literally came on the scene a month ago. And in 1 month, it became the dominant variant. So for me to tell you what it's going to do and the damage it's going to cause, it's unknown. So mostly Omicron is more upper respiratory. It's in the nasal, in your sinuses more than in your lungs. But then again, I just had a patient get a blood clot. So it does affect some people in their lungs, and just like COVID in general, it's a combination of all your vulnerabilities and a summation of all your chronic disease. It attacks you at your weakness.
What your vulnerability is, yes.
And so there's just no way to predict how any single person is going to respond to COVID in general. But I mean, personally, I've not seen a single case of long hauler, long COVID. I really haven't. And we said I'm looking. I don't want any of my patients to get it, but I'm want to kind of experiment on managing it, because I'm hoping we could do something about it.
Okay, Randy, thanks for calling. Siobhan?
Yep. Up next, we have Tony and Wayne. Tony, what's your question?
Yes, I'm on Plavix, and I was told not to take vitamin C because it could cause more bleeding.
I'm not aware that vitamin C causes bleeding. And let's just say if you're asking me and you say, I just want to be cautious, I don't think vitamin C is critical. I think vitamin D3 is more critical.
Yes,
And
I take that, yes.
And I think zinc is more critical, and so is the quercetin. The only reason to take vitamin C is because it helps with the absorption of the quercetin, which is a natural anti-inflammatory. So the vitamin C isn't critical. And again, I'm not aware, I'm not familiar with vitamin C interfering with Plavix.
Yeah, my dental hygienist told me this.
I'm not familiar with that.
Yeah, okay. Well, I did go online, and I could not find anywhere that it said that it interfered with the Plavix at all.
Well, thanks for fact checking me.
Right.
Yeah.
Well, I've just been
All right.
fact checked.
We have another caller.
Thanks.
Yeah. So we actually have another Canadian caller. We have Dave now in Windsor. Dave, what's your question?
Yes, good evening, people. Thank you for taking my call. I hear often on Canadian stations get vaccinated with the coronavirus. You're suggesting that it's no longer beneficial, no longer helping. I would like to commend you on that, because it is no longer helping, because many therapeutic treatments such as zinc and vitamin D3 are much more beneficial, and I believe that they can help in this kind of virus, even Omicron. What can you suggest about that?
Well, I agree with you, and so I thank you. And I tell everyone, just as we said, is take a cocktail of supplements that help boost your immune system. So anything that boosts your immune system is important, and it goes beyond just the supplements. And we talk about this in general prevention. I think that's the most important thing to do, is get your body healthy.
Yep.
Stop eating sugar. Stop eating processed food.
Yep.
Because those things drive insulin resistance. Insulin resistance affects our immune system, imbalance. And so if you're able to do more weight-bearing exercise, which burns sugar without needing your insulin receptor, so this is a silent killer. Making sure that you identify sleep apnea if you have it, so that you can help boost your immune system. There's so many drivers of chronic disease that negatively impact our immune system. But one thing we can all do is take all these supplements. And the other thing, of course, is early treatment. Get treated early by someone who's willing to treat you. And again, I would say these days, don't bother with testing, because you can have COVID and have a negative rapid and a negative PCR. If you want to get a PCR down the road as a double, triple check during or after treatment, fine. Just to say, you know what, I guess I had it. So you can say you had it, which is important, because who knows what natural immunity Omicron is going to give us in the future. You know, natural immunity is important, and we just don't know. What we do know is Omicron gives you immunity to Delta, which doesn't actually matter because Delta's gone. But who knows what it's going to give to the people who've had Omicron moving forward.
So, Dr. Kolender, are you assuming then that if your patients call you, you're not saying that they need to get the rapid test or the PCR test? You're just assuming they've got COVID if they have the symptoms of COVID, and you're going to treat it as if it is COVID.
Now
No.
I am. I mean, that's a change
Right.
because before I was using hydroxychloroquine in a Z-Pack, and there are some issues with using those drugs, and I want to make sure the person actually had COVID. The other reason is that pharmacies weren't filling the prescriptions unless you had COVID. So the person had to have a positive test to go to the pharmacy. And now, because Omicron is not as severe, I felt that using the other drug, which we're not going to mention, would be safer and effective. And my experience is it has been. Some people, however, I've needed to double up. I've had to give them vitamin I and hydroxychloroquine in a Z-Pack because they had severe cases. But testing, I learned the hard way. Some people were sick for 10 days, and then they called back and said, oh, my third test is positive. Well, after I heard that 3 times, I stopped getting tests.
All right, let's come back and talk some more about this on the other side of the break. You're listening to a special live broadcast tonight where the topic is your health and how to prevent disease. When we come back, if you have a specific question on the subject we're discussing and would like to hear from the doctor directly, please call us at 800-859-0957. Again, that number is 800-859-0957. You're listening to News Talk 760 WJR.
Okay, so we're back on Facebook Live.
No pig hearts yet.
No, well, we can't get to it because of
Well,
all these.
this might be your chance. Right now we have no callers left, so this might be your chance.
For a few minutes, we'll
We can
see.
save it for the
I
last
doubt we're
segment.
going to make it. Although I'm not really,
Yeah.
well, my cousin in Florida loves the show. Just texted me.
Oh, that's great.
Right.
That's good that I'm glad you've got.
Yeah.
Where in Florida?
He's in Parkland,
Okay.
which is where the shootings were, unfortunately. But
Mhm.
it's
Oh, right. Yeah.
yeah. Well, he didn't know I was doing this show, and he's a hardliner. Suffice
Hardliner
it
in
to
what
say.
way?
Well, there's only one way.
See, I think it's anachronistic. I mean, I think that when people that are calling now, and you're saying don't get vaccinated, which is Biden was on this morning, the president saying everybody needs to get vaccinated. You're saying don't get vaccinated. But the reality is the need to get vaccinated was a year old.
Right.
So at the time when this was all new and people were, just
Can you
dying
say
on
that again?
ventilators. What?
Could you say that again?
Say what again?
Like what you just said.
It was old.
All right.
It was anachronistic. So it's kind of like it doesn't, to say don't get vaccinated. You were vaccinated. I was vaccinated. Siobhan
Well,
was
at the
vaccinated.
time is what you did.
But that's the point.
And if I knew then what I knew now, I would not have gotten vaccinated.
Why not?
Because I had natural immunity.
Well, you had natural immunity because you got COVID.
But I did not know at the time I got vaccinated that having had COVID protects you in the future. I would not have gotten vaccinated.
Well, you got another boost of security by
No,
getting the vaccine.
actually,
Didn't do you any harm.
who's to say?
You're not
The
dead.
vaccine actually limits your immunity. It narrows down the focus instead of being broad-based.
Mhm.
So
can it override your natural immunity? Is that
it is.
okay?
It is. And again, to say it is in a strong way, like it's depending on who you talk to and it's a study you read, it's all being argued, a lot. So there's a theoretical possibility that ongoing vaccination is going to harm you. And so, why get a vaccine? Why get any drug that has no benefit? Period. Don't get that.
Sure.
3 calls.
You have 3 calls?
3. Yep.
Let's
Oh,
move
no,
this.
we just lost one, so we're
Oh,
down to two, but it's okay. But the testing thing is interesting because I've noticed, at least in the music world, that's now it's like vaccine and test. I have to play at the arena in Miami, and they want you to be fully vaccinated and do 2 days of tests.
well, there's been a lot of people who've missed opportunities to make money, lost money over bad testing.
Yeah.
There's no reason to test anybody who's asymptomatic. No people who have no symptoms spread the drug. I mean, spread the vaccine, the virus. So I'll say it's right. Thank God we're not in the air. Okay, good. Let me have a glass of water. You guys talk a while.
Oh boy.
We're down to 4 listeners.
We have how many?
2.
Four,
All right.
4 listeners.
The great voice.
All right. Well, 2 calls when we start up.
3, okay.
Oh no, we have 2. 1 dropped. We have 2 now.
Welcome back to the final segment of our special weekly live broadcast here on News Talk 760 WJR on the importance of being proactive and informed of the resources available to prevent and treat chronic and debilitative disease. You're listening to the expert advice of Dr. Brian Kolender, MD, internal medicine physician, and one of the very few specialists in prevention in this country. If you have a question for the doctor, now is your chance to call us at 800-859-0957. Again, that's 800-859-0957. And Siobhan, my co-host, you have callers?
Yes, we have Tom on the line in Troy now. Tom, what's your question?
Well, I really don't have a question. I'm a pharmacist, and I concur with Doctor that many physicians are reluctant or prohibited from prescribing preventive medication, and we are having limits on what we can get with vitamin I. So even though we are willing to fill prescriptions, it's difficult to even get the medication now because of our limits that our wholesalers are putting on us. So
Right.
I just
Well, I would love to talk to you more, but I don't want to risk you or me about the conversation we're
Right.
going to have. So,
right, but I appreciate your, you're going forward and stepping up and explaining this because it's refreshing, and I concur with you and I congratulate you.
well, thank you. And this, again, we're going to go back to calendar mandate 2. Got to keep
Okay.
these in order. Find a pharmacy that's going to fill the drugs that you need when you need them. And I've had trouble getting my drugs filled that I need from the major pharmacy brands. And so AnnMarie says, don't say them anymore, so I won't say them, but you know who they are. Find a
Well, you
local
already said them
pharmacy.
enough times, yeah.
Find your local mom and pop pharmacy that's going to write your drugs. Find your under the radar compound pharmacy that's going to make the things that you need. And your patients are going to, your listeners are going to have to pay cash because this stuff can't go through insurance because it flags everybody.
Correct.
And there's ways around this.
You're right.
So, but it means I don't want to give business to these pharmacies for my standard drugs when they're not going to be there when we need them. Screw them.
I agree.
Thanks for
Yep.
calling.
Thanks.
I agree.
And Dr. Kolender, once again, I think it's incumbent upon the doctor that's treating you and writing the prescription to make sure that he knows of at least one pharmacy you can go to as a patient. That'd be frustrating to drive through, some of these big box pharmacies and be told, sorry, we're not filling your prescription and not telling you where to go.
And so, this person who just called mentioned the limits. I mean, there's more. It's limits of the total amount of the drugs sent by the pharmacy, the limits per person. I mean, it's horrible. It's an abomination. It really is. And then to complain that the hospitals are full when you won't do anything to keep them from being full.
Well, that's just ridiculous.
I mean, come on.
Siobhan,
We have another caller.
Yeah.
Siobhan, you have another
We do,
call?
yeah. Up next, we have Brian in Grand Blanc. Brian, what's your question?
Actually, I have 2 quick ones. First one is can you clarify if there is a way to tell the difference between the Omicron and Delta? Because I've read both sides of that, and I just wondered if you know if there is a way to tell.
I'm going to say no. And so these are tested in advanced research labs, and I'm just going by the epidemiologists who are telling us that Delta's basically gone and it's all Omicron. I'd like to think I can tell by the symptoms, but that isn't always possible either. To me, there's a distinct difference between people who are sick in first week of December and the second week of December. It was a total different symptom complex, total different recovery. People stop responding to the first set of, the drugs I've been using for 18 months, and I switched things over. I mean, I changed my whole treatment plan in like 2 days after watching this for 3. It was quick.
But once
Wow.
again,
Okay.
yeah, once again, you're talking about patients that have access to you, your patients, because you're customizing everybody's treatment.
Well, I knew Omicron was, you all knew it was coming. You just didn't know how. And it was to me, there was a clear, it was a few days where I said, okay, this is not Delta anymore. Let's move it along. And if it's not Delta, I don't want to use hydroxychloroquine because it's just not that bad of an illness.
Are you-
But I did add it to some people.
So, you're talking about how the testing is unreliable. You can, a false positive, a false negative, you don't rely on it. What is the average listener supposed to do? The patient out there who suddenly gets a high fever, gets sick. If you're saying that don't rely on the tests and on the testing, what are they supposed to do if they think they have the virus? If they think that they have the Omicron virus, what are they supposed to do in order to get cured?
Well, it's the same thing we've been saying all along is if you've waited to get sick, you waited too long. It's the same thing about waiting to have a heart attack or a stroke or having dementia. You waited too long. Prevention for COVID is finding a doctor that you know is going to treat you, making sure that doctor has a plan, making sure you can reach that doctor when you get sick, and on your own, make sure you're taking care of yourself, that you have the supplements on hand, that you have your plan. And a backup and all those things for everybody. So now I'm actually giving all my patients who want it like a kit, a COVID preparedness kit.
Oh, that's brilliant.
Yeah, and
Yeah, that's brilliant.
So I'm making sure especially if they travel out of state, before they leave, I'm making sure they have all the supplements. I send them out with a packet of the drugs that I want them to have because the other things I'm more likely to be able to prescribe. So now, because you couldn't prescribe hydroxychloroquine without having a positive COVID test, the other things I'm using, you just pay for them. You can just have it on hand. So I'm anyone who spends a winter out of state, I'm making sure that they have a kit. And now I'm trying to find similar type compounding pharmacies in other states that I can call and have them shipped within that state. Because some of these pharmacies just aren't equipped to do interstate medicine. Like they're not allowed to. They're just not allowed to ship between states.
So what people ought to do and what listeners ought to do if they're afraid of succumbing to the COVID virus, they need to talk to their doctor. They need to find a doctor or make sure they've got somebody that, hey, if I get sick, you're going to treat me and you're going to be able to provide the right types of medication and I'm going to be able to get a pharmacist to fill it. I mean, it's
The hard
pretty much,
part's finding the doctor actually, because
Oh, yeah.
that's the hard part. I mean, there are like this gentleman who called, and there are, under the radar, cash-based compounders that are filling scripts and doing everyone's work.
Are we still on the air? No.
No, you're going to commercial. Oh,
Sorry.
just an interlude,
It was just
everybody.
an interlude. Sorry, I just heard the music and I thought we are getting cut off early. But anyway, yeah, I mean, once again, it comes down to you have to be your own advocate. I mean,
Yeah.
you have to make sure that you are in the care of a doctor that's going to answer your calls, see you, treat you, and give you, take care of the illness because that's what doctors are there for.
It's the same problem with preventing heart attacks and strokes. You got to find someone who knows what they're doing with prevention, who's going to identify disease early and take all of the drivers of chronic illness seriously before they become symptomatic in a traditional way. And this is exactly how we're treating COVID.
Right.
And this is why all these adaptations we've had to do, how the changes that we've made over the last 2 years, it's because I'm already doing it, with prevention. My practice changes constantly. It's a fluid practice. And COVID's changing rapidly. Who knows what tomorrow's going to bring?
Very important for everyone to get into a practice that specializes in prevention. That's, I guess, the message here. Well, unfortunately, we're out of time, so I'd like to quickly thank Dr. Brian Kolender, MD, specialist in prevention, for being here tonight and for being willing to share his expertise and knowledge with regards to not only the prevention of disease, but also on the importance of being proactive and engaging with a practice that provides access to the necessary testing. This show is brought to you by Kolender Medical. I'm your host, AnnMarie Cronin, and we hope you got some useful information tonight on how to be your own advocate and take charge of your health, whatever your medical journey. Thanks to my co-host, Siobhan Cronin. Please continue to tune into our shows Sunday afternoon at 3, Thursday evening at 7 for the latest medical updates. And thanks for listening to News Talk 760 WJR. Good night and be well.